Do you have knee pain that's stopping you from doing activities you like? Or do you play sports and find that squatting or jumping is quite painful for your knees? Do you find sitting for a really long time quite painful? Or have you been to multiple treatments and still can't find the real cause for your knee pain? Hi, my name is Quinton and I'm a physiotherapist here at Pain-Free Physiotherapy and Allied Health. I'm going to talk about patellofemoral pain. Patellofemoral pain can be described as pain around the front of the knee and may be referred to as jumper's knee, runner's knee, or even moviegoer's knee. That being said, the pain can gradually get worse when you walk, run, go up or down stairs, squat, or even just sitting for long periods of time. However, patellofemoral pain is a poorly defined condition and is rather used as an umbrella term for the pain at the patellofemoral joint. So the patellofemoral joint is made up of the joint surfaces of the patella, which is the kneecap, and the femur, which is the bone of our thigh. Now, there are many causes that can result in patellofemoral pain, so it can be hard to find the correct diagnosis. But most of the time, it is often related to the delayed onset of the vastus medialis oblique muscle. So this is one of the quadricep muscles on our thigh. Or it could just be weakness of the quadriceps in general and alter the biomechanics of the joint. Now, there is another structure on the side of our thigh called the ITB, which stands for iliotibial band. And this attaches onto the knee as well. So if that's tight, it can also pull on the knee and then cause an imbalance to the biomechanics. Another factor that may increase the risk of developing patellofemoral pain is from overuse, particularly in sports that put a lot of repetitive stress on the joint, such as running or jumping. Injury or trauma to the kneecap can also lead to patellofemoral pain, particularly if there is a dislocation or a fracture. Now, some may say that having a large acute angle is a predisposing factor for patellofemoral pain. Now, the acute angle refers to the angle made from the ASIS and the patella, as you can see here. Having a broader pelvis will also increase the acute angle as well, so this can also be considered as a predisposing factor. But that's not to say that if you do have a broad pelvis, you will always develop patellofemoral pain. There are people who have broad pelvis or increased acute angles who do not have knee pain. Your doctor may tell you to follow the RICE method initially, and this is quite important, particularly if it's still in the early stages with the main emphasis on rest. Ice can be used to help reduce pain or swelling. Your doctor may also prescribe you some medications for pain relief or anti-inflammatories. Then they'll refer you to see a physiotherapist. Now, physiotherapy has been found to have good short and long-term outcomes for people with patellofemoral pain. Many of the conventional treatment methods for patellofemoral pain have been focusing on the VMO, the vastus medialis oblique muscle, or quadriceps training, or mainly strengthening. So releasing tight lateral structures such as the TFL or ITB, as it can pull the knee out towards the side, and also taping. However, the results following these types of treatment have been largely ineffective or no better than placebo, according to some research. At Pain-Free, we're experienced at using a holistic approach to assess and treat your symptoms. Rather than just focusing on the painful area, we will look from the head to toe to find any other factors that have led to your symptoms. A lot of the time, we have found that the cause is not in the painful area. For example, having a tight calf or having an altered walking pattern or flat feet that is causing your knee pain. At the end of the initial treatment session, we will go through a treatment plan that outlines three main things. Number one, what is the cause? Number two, what treatment do you need? And number three, how many sessions or how long will it take for you to achieve your goal? We have an assessment tool called Gait Scan that allows us to look at how your feet move when you're walking. The Gait Scan plate has 4,096 sensors that scan and capture the foot mechanics, and it can show you the pressure distribution of your feet through a color-coded analysis. We also have a podiatrist here at Pain-Free Physiotherapy and Allied Health, Jeff. He's here to talk about how the feet can change the alignment of the knee and how the right footwear and orthotics can help with your knee pain.
Thank you, Quentin. Yes, most definitely there's a link between your foot posture and also patellofemoral pain. So what happens is, if you think of our body as a building and your feet are the foundation of the building, so if you have very unstable or too much movement in your feet, that will affect your knees as well. So a lot of times people come to see me with patellofemoral pain, they also have excessively flat feet. Now, as your arch collapses this way, that will cause movement to the ankle, that will cause movement to the knees as well, because they are all connected. As a result of that, you have excessive amount of rotational forces in the knee, which causes patellofemoral pain as well. So apart from what Quentin will suggest you, strengthening exercises, what we can also do is we can prescribe you a set of custom-made orthotics. So what we do is we use this orthopedic device or orthotics to reduce the amount of unwanted movement to your feet. So basically, we want to make your feet more stable. If you have more stable foundation in your body, then you will have more stable knee. And if you have more stable knee, then you will have less patellofemoral pain. That's it. Thank you very much.
If you or anyone you know is still suffering from knee pain or patellofemoral pain, is still not getting the result you want from other treatments, feel free to contact our clinic and we'd be happy to answer your questions about patellofemoral pain.